use SlideShare? I mean, I just Googled, botulism PPT, PowerPoint, and SlideShare I mean, they have commercials you can, and stuff that you have to buzz through, but it's actually pretty decent. So you might find that to being something of interest for you down the road. So as soon as I can get it to work, I'll get it to work down here because I've used these in other courses. So I have two questions: one about botulism, one about Alzheimer's. The Alzheimer's is not so much of an infectious disease, but it may or may not have an infectious origin. There's some interesting things about it. So I'll give you my spin on it. Unfortunately, I'm sure I mentioned it. If I didn't, I'll mention it again. I unfortunately have entirely too much experience with Alzheimer's because my mom succumbed to it. So, and I can tell you what the doctors told us about my sister and I. So we'll start. Botulism is very famous. When you talk about infections that are food related, people, oh, I got food poisoning. Oh my God, there's food poisoning is not fatal unless somebody's got a lot of pre-existing because it's vomiting and diarrhea, and so you're looking at fluid and electrolyte imbalances. The reality is the only food poisoning that is immediately fatal is botulism. Okay, so in micro, you guys certainly looked at endospore forming bacteria. There are two categories, aerobic and anaerobic. Aerobic is the one used in the laboratory, bacillus, like B sub, Bacillus subtilis. Bacillus is also the culprit for a very, very famous disease called anthrax, which is also potentially has been used as has been not potentially has been used as a biological weapon shortly after 9/11 because they tinkered with the endospores and got them past the nasal barrier, and they can be fatal in that regard. But the ones that are much more problematic are anaerobic infections because they live in dead tissue or they live in anaerobic environments. Surely the most famous of those, and you're all immunized for it, is tetanus. So you run into what when I presented in micro, we do the four Clostridiums. Clostridium botulinum for botulism, Clostridium tetani for tetanus, Clostridium perfringens, which is gas gangrene, which is entirely different than the gangrene that a diabetic gets because that's typically non-infectious. It might be secondarily infected, but the toe or the finger or the part dies because of an absence of circulation. And the one that you hear the most about is called Clostridium difficile or C. diff in the hospital, and that's not pleasant at all to get. So botulism is something that happens in food processing. Particularly, the thing you probably have to worry about most is commercial canning of some type, or particularly, and I was just having a discussion with Dr. Hilwick because she does home canning of salsa. She likes to do that. Now, you don't have a big worry with that because it's very acidic. And so you don't have to really go through tick all the boxes if you're going to have a true commercial, a true canning, process that a lot of people use. When you use things that aren't inherently, so people harvested vegetables in September and October and started putting up, asparagus and green beans. You got to be real potatoes. The worst epidemic we ever saw with botulism, not epidemic's the wrong word, the cluster of botulism cases came in like 1967, 1968 from vichyssoise. Everybody know what vichyssoise is?
No.
Cold potato soup. It's very French. It's vichyssoise. It's like chopping things in a fine dice. They call that grimace. Okay, eighth-inch little cubes. So vichyssoise is a potato leek soup that's served cold. And this place, of all places, in Newark, New Jersey, right by the old Newark airport, was the plant. And the plant was Bon Vivant Vichyssoise. So they gave it a very interesting name. And people got that. And so, and about a dozen people died. Needless to say, the company didn't survive very long after that. Nonetheless, worse for people. Botulism is a paralytic disease. You take it in orally, and it travels through your nervous system, and effectively it blocks signals. It blocks the neuromuscular junction, so people succumb to flaccid paralysis, inevitably respiratory is where that comes from. So, and it's the strongest neurotoxin we know. Tetanus is in that. Yet we harvest it in microdoses for Botox. Botox, if you didn't know it, is botulism toxin. So when you hear about somebody, because it's a paralytic, and originally they started to use it for tiny, for eyes and things like that, so it relax the muscle selectively so people wouldn't get that sort of a wrinkled kind of appearance. And they used it for people who perspired a lot because it would block the acetylcholine receptors, like in the underarm. So there's been a lot, they used it for headaches. So there's been a lot of things for Botox. And we're talking about microdoses that are there. So symmetrical, both sides, descending flaccid paralysis, which is different than a stroke, which is a spastic paralysis. Tetanus is a spastic paralysis. So even though they're both similar powerful toxins, tetanus blocks every nerve going into a muscle. Okay, the upper motor neuron can release one of two neurotransmitters, and we go over this again when we have fizz. You can either be glutamate or glycine. Glutamate stimulates it, glycine quiets it down. It blocks the receptors. So any stimulus a muscle gets is excitatory, going to cause it to contract. So it leads to spastic paralysis. That's tetanus. And so and typically this starts high and works its way down. So the first thing people, if you ever work in ER and someone comes in, I just had, what did you eat? I can hardly open my eyes. I don't know what's going on. Bing. And most of them have and the treatment for any toxin, for any toxic thing is an antitoxin. And large hospitals have antitoxin, they have tetanus antitoxin, they have botulism antitoxin. If you're in the right area of the country, they'll have multi-potent, multi-potential, I'm trying to think, polyvalent snake venom, anti-venom. So it'll cover a whole range of snakes. Snakes? A buddy of mine was the lead pharmacist. I told you this, didn't I? Down in Texas. And we're in his house. I said, oh, he goes, grab a beer out of the fridge by the bar. I opened it and there's like 6 vials of anti-venom. I'm like, do you add this as part of something for a cocktail? He goes, no. Because he had to travel around to like 6 different pharmacies and supply him with anti-venom. A lot of snakes. You guys, you're not having much fun. Anaerobic, gram-positive endospore former. That's the problem. Endospores, once they go in an anaerobic environment, they grow, and they're forever. It's on your shoes. Right now, everybody's got tetanus and botulism on the bottom of your shoes, in the carpet. It's there. Okay? Most potent of the bacterial toxins. Come on, make me look good. So, resistant to everything. Can't boil them. It doesn't work. That's why you have, when you're doing canning appropriately, you have to bring them up to the levels that you would have in an autoclave or a commercial sterilizer. Okay? So conditions, anaerobic conditions, relatively warm, mild alkalinity, acidity blocks it. Go to free slide share. No, thank you. I can skip to the next slide. Okay, different types, different feces, etc. So, but you can detoxify it by boiling. So if something had it, what's the number one substance that we have problems with botulism that people don't really know about, particularly for infants?
Honey.
Honey is correct.
What you guess?
Honey is correct. I had one of my students way back in CCAC about a good 10 years ago. He says he saw something growing in his home brew and brought it in, and we cultivated it, gram stained it. Guess what? Botulism. Because he was doing home brew with honey base, basically making mead, which is the original alcoholic beverage for just saying. And I realize I have some authorities here in the room on that. I know you're an authority.
Oh, okay.
Okay, and different ones as you can see. So there's more than one. All of that. Contaminated wounds can also get it. Inhalation could theoretically get it, but mostly it's ingestion. Okay, eating foods that contain the toxin. Not the endospores themselves will be less problematic than the toxin. Okay, and now you can see it a little bit more in children. Sometimes you could germinate inside there, wounds theoretically. So the thing we were always on the lookout in surgery is if there was an infection, you're going to get what's called tissue necrosis. Tissue dies. By definition, when it dies, it no longer has a blood supply. So that's what you're worried about. I mean, it's like, if somebody had a wound, just a backyard wound, if it got infected, that's when you start to worry. That's why there's a whole category where I get into tetanus and non-tetanus prone wounds. 90%, 95% of all wounds are you're a kitchen injury. You cut like I did the other day. You're slicing a bagel, you miss, bang. Non-tetanus prone wound. Don't have to worry about it. Why do they always give you, well, I'd like to give you a tetanus shot. One, it makes the hospital money. Let's be clear about that. And two, they want to cover you for that time that you get an injury and you don't get medical help rapidly right away. You're in an accident somewhere in a remote area. Maybe you're camping, maybe you're hiking, whatever, and you end up with a tetanus prone wound there. That's why you do it. And if you did not know, you're getting 3 immunizations in one. You're getting diphtheria, which is a non-endospore forming gram-positive rod. You're getting pertussis, which is a gram-negative rod, and you're getting the tetanus. Just saying. So DTaP is called. Acellular pertussis is always a tough one. So highest incident, as you can see, not necessarily around here, home canning. The median number of foodborne cases per year back before 1990, 2023, okay, have occurred almost exclusively in injecting. This is the secret sauce with a lot of anaerobic infections, and maybe most notoriously, is another one I talk a lot about. I've seen 2 cases. Necrotizing fasciitis. The flesh-eating bacteria. Most of the time, they're a streptococcal variant. My first wife's uncle, a diabetic, very brittle, got that probably from just an innocuous wound. We thought it was phlebitis. We thought it might have been a mild cellulite. Treat him with antibiotics. He wasn't getting better. I sent him to the head at whatever hospital, Montefiore's head of surgery, who lived in the same area. These were all from the Squirrel Hill community. And he called me up in my office up in Oil City and said, I would, if I hadn't seen this when I was a resident in Boston in the 30s, so it was a long time ago. So I would know. He says there's necrotizing fasciitis. We have to amputate, and he did. That's the treatment. Why? The reason I bring that story up now, and I saw one from a drug user. Okay, where are we seeing a lot of that now, and apparently botulism as well, is people injecting themselves. There's a lot of those bodybuilding steroid users, and most of the time it's like the Jose Canseco book, where they're in the bathroom and it's not, let's say it's not clean, and you have somebody shooting up his buddy in the butt and has no idea what the hell he's doing, and that's clearly what happened with a lot of these people. Okay, just saying. Okay, bloodstream binds, cholinergic, blah 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 blah. So and it's respiratory. That's the big problem. More than anything else. Respiratory. I'd like to go yet free. Doesn't take long. So, I mean, you get in an emergency room, you get an idea. Low acid foods, as I said, asparagus, the stuff that people, I don't know if you do it at home and do home canning or not. A lot of people my wife just has one downstairs. I got a commercial canner that we're going to be using with her mom being sick. It kind of took away from us doing the garden. Double vision, difficulty talking, swallowing, all of these things, descending. There's an interesting disease that you might have heard about, particularly during the COVID vaccine issues. And I don't want to get into a discussion about the actual merits of the COVID, quote, vaccines. But there was a disease called Guillain-Barré. It's not a disease, it's a syndrome. Guillain-Barré is an ascending paralysis. Starts with your legs get weak and it works up and eventually gets to breathing. So Guillain-Barré, back in 1976, we thought that we had one of these killer flus, a swine flu epidemic. And at that time, President Ford, who had taken over for Nixon, but it was eventually being voted out of office right around the time of the election, they decided to do a wide range immunization after an outbreak of what they thought was swine flu. In a cluster where they did the immunizations, a bunch of people got Guillain-Barré. It wasn't an inordinate number, but they immediately stopped it. they were going to immunize the whole country. And if you think there's not precedent, there is. Well, ask anybody who's my age. I know you'll have trouble finding those people. They're still around. Thank you for the smile.
You're welcome.
Thank you. For the rest of you, I don't want to be spraying anybody. We immunized the whole country for polio when we changed from the injectable vaccine, the Salk vaccine from Pittsburgh, to the Sabin vaccine, which was the oral, because polio is passed orally. Every month for like about 3 months, we all went to our community centers or high schools or churches or wherever you went, and the whole country got they made sugar in cubes, and they put a drop of the liquid, and we all took it, and all the doctors and all the nurses. To show my favorite story of how this changed, today, could you imagine an underage kid without their parents receiving that kind of a treatment? Somebody would give somebody an immunization, even an oral immunization. I slept over at my buddy's house. His dad called my dad, said, "Hey, we're going to high school. We'll take Lou for the polio stuff." My dad says, "Okay, we're going to Little area. I'll tell him." My dad didn't have to be there, didn't have to sign anything. That's how you used to do it in this world before everybody went effing crazy. Okay, so you get the idea. Symmetrical paralysis, respiratory or respiratory paralysis. So wounds is a little bit different. Cesarean deliveries. These are the kind of things when people do things, unfortunately, sometimes because it's everywhere. Understand, that's why it's so important to have, even if you have to do something at home or in a car or some type of procedure on the side of a road, things happen. We have to be very cognizant of that. Honey, not recommended for infants under 12 months, all the different things. Symmetric descending paralysis, I shouldn't have skipped that, who are afebrile and mentally intact. Thing to remember. Okay. And I know what they're doing with ad-free. Thank you very much. Note the weakness of his eye muscles. You can see that. That's a good slide. And yeah, you can find out all of those things if you can isolate. You can isolate the toxin or an early antibody response. ELISAs, and you guys are familiar with a lot of this stuff. I know. And here's the differentiation: Guillain-Barré, myasthenia gravis, which would be a much more slow onset. I've had patients with that. Stroke, much more distinctive and typically one side. Tick paralysis, what we used to call tick bites, is probably, it's sort of migrated to in the sphere of Lyme these days. And please be aware of that as a possible. We live in Lyme disease central. Not this time of year, even though the unseasonable warmth we've had may contribute to that. That's part of it. The ticks, basically, their life cycle is involved. Why they call it the deer tick is they end their life cycle by mating and hatching eggs on a deer. It's a 2-year life cycle. Ixodes scapularis. Just shut up. Nobody cares. You're so freaking smart. Okay. Infants treat a passive immunization. Years ago, we used to use a lot of they used horsehair. They used that for tetanus. And the problem when you had to give somebody who had a tetanus prone wound and you had to give them the anti-serum preventatively to get in their bloodstream, you had to put a little drop in their eye to make sure they didn't have an allergy to horses. Now a lot more of this is GMO type stuff, genetically made materials that are there. So I thought that you'd find that. All right. So I think that's my little spiel. Everybody pretty straight. Equine, as you can see, 9%. I did all this stuff. Okay, Alzheimer's. And then I'll be open to other suggestions, depending on how long this discussion takes. So here's the interesting thing about Alzheimer's. When you guys had micro with my colleague, Dr. Maurer, did you discuss prions?
What?
Prions, Prions. I don't know if he pronounced he called them prions. I call them prions. Okay, he probably did. So prions or prions, however you want to describe them, are misfolded proteins. And they, when we think it's by ingestion, and we think it's organ material, particularly neurological. That's sort of the theory behind Kuru and cannibalistic drives. How's Uncle Joe? Delicious. You know,
Uh, it was good. Listen, I'm trying my best, okay?
yeah, it's okay.
Got a case of the Mondays today.
Hey, look, did you watch the Steeler game? That would give anybody a case of the
Well,
Mondays.
Jordan went. Yeah, I was there.
Oh, it's awful.
I was
I talk about hoping that the storm canceled the game before they could complete it. Anything like that. But we digress. Okay, so prionic. I'll use my way because I'm used to it. Are misfolded proteins that we typically believe come from ingestion of neurological. The classic example is mad cow disease. So they're called spongiform encephalopathies, meaning post-mortem you would see spongy deteriorate, like holes developing in the brain post-mortem. Now we obviously can use MRI technology to be able to identify that pre-mortem. They're always fatal. Right now, there's a lot of treatments proposed and some being utilized. There's no global treatment for this. And what happens is misfolded protein would bang into other proteins and cause them to misfold, and sort of like a chain reaction. That's the skinny on that. Classically, you find these findings with Alzheimer's, and you find similar findings with mad cow disease. The neurofibrils, when we look at the anatomy of nerves, which we really didn't, microscopically, nerves have passageways in the cell, okay, called neurotubules, okay? So our neurofibrils, I beg your pardon. And neurofibrils are both-way passages. When you get tetanus or botulism for that matter, it's a neurotoxin. It travels in the nerves along those fibrils. So normally neurotransmitters go point A to point B. They don't go backwards other than something called reuptake. So what happens is that we think that these prions end up causing tangles in those neurofibers. So we see neurofibrillary tangles. Interestingly, one of the hallmark findings of an Alzheimer's brain, and again, they couldn't make the diagnosis other than postmortem years ago, was neurofibrillary tangles. They found colored substances, chromatophilic materials in the cell bodies, the quote unquote nucleus area of a nerve cell. We call it cell bodies because of the terminology. I'm not sure how that plays into it, but the big player is something called neuritic plaques. These are amyloid-like plaques. Amyloid is something where a protein interacts with another protein. So a protein is abnormal, may form this material called amyloid, is either an antibody antigen complex of a protein and another protein. And that may be the major thing that leads to the progression of Alzheimer's. So neurofibrillary tangles, chromatophilic substances, colored pigmented substances, and the neuritic plaques. Very similar to mad cow. So I had a student in one of my CCAC classes, again, about 10 years ago, and her husband was a PhD researcher at Pitt, and basically he was doing research into that. And nowadays, about accepted numbers, at least 5% of Alzheimer's cases are probably related to that, to prionic ingestion or prionic ingestion. Because there's so many other, I mean, they may all be the same disease with subtle modifications. Kuru, they have scabies in sheep, they have a disease that affects mink, a disease that affects deer. There's a lot, as well as cows. So it's multi-species type of thing. And so there's a lot of interesting stuff, but I haven't looked at this PowerPoint, but I'll scroll through it with you and give you my thing. My spin is the easy spin. My mom. Okay. My mom was driving herself at 86 years old from Rochester to New York, back to to where we grew up in northern New Jersey, by herself, one stop, between multiple times, a couple, 3 times a year, between 1984 and 1986, all the time. At that point, she was 78 years old. Is she that old? I'm going to tell you. Born in 1918. No, she's. I beg your pardon. Not. She was 86 years old, so that would have been 2004. After suffering a fall when she was there the last time, things kind of started to change. Didn't heal well. She fell again. Probably it was probably the onset, not early by any stretch at 86 years old, but that happened. But she had to stop driving, and I mean, she was still. We would watch Jeopardy together when I would visit her. She would still get the answer before I did, which is no mean trick. And then she started to go downhill from that. And then by age 88, because she was living independently, she was they have a lot of these. So hers was the Jewish Home for the Aged up in Rochester, New York, because my sister lived there. And she had lived independently, beautiful 2-bedroom condo, but you paid a lot of money, a big bond. I think at the time the bond was like 140 grand. Okay. And so I spent all my inheritance. Don't worry about it. And then she moved to assisted living, and then after about a year of assisted, she moved to the nursing home where she succumbed. So once about 1988, 5 years, quick downhill. What they said, my sister and I had a group call because I was in New Jersey. I was here in Pittsburgh, and it's like, what's happening exactly? She goes, think of Alzheimer's like this: when you're a baby, you learn how to walk, you learn how to talk, you learn how to swallow, you learn how to do all of those types of things. Imagine all of those things going in reverse. That's kind of the clinical manifestation. So eventually, you're no longer able to swallow. You're no longer able to have any. It's almost you're just laying here. And every so often there'll be a little glimpse of reality. Very fascinating disease. And so she was in that state. I would dare say, pretty bad for the better part of a year. Very, very little recognition. I couldn't. It's my fault, my failing. I couldn't be there. I couldn't take it. I always want to remember my mom and my dad as they were, sharp, intelligent, interactive, and all that. My sister couldn't go a day without seeing her. She was the other way around. There's no right or wrong. That's just me. It was very, very hard for me. I went there with my wife, and oh my God, that was a very difficult day. So that's my concept. For a while, they felt that some of the treatment that is still used today is called Aricept. When we do the neurotransmitters, the most common neurotransmitter of them all is acetylcholine. Okay, that's a neuromuscular junction. It's in the brain. It's in the sympathetic and parasympathetic nervous system. What they used was called it's an acetylcholine esterase inhibitor. The way your body breaks it down, there's an enzyme everywhere that breaks that down into acetic acid, vinegar, and choline, which is recycled. So what this does is it blocked that pathway to allow more acetylcholine to be available. For about a year between when she was 88 to 89, that helped and stuff. So degenerative brain disorder, effectively still classified as unknown etiology. We don't know. Etiology means cause. Most common form of dementia. It's really tragic. If you want to see a wonderful, maybe you've seen it. It won an Academy Award. She won, Julianne Moore. It's called Still Alice. It's a very interesting movie where she was a linguistics professor and went through her deterioration. Brilliant. Late middle age or an old age, progressive memory loss, one of the first signs, particularly short term. All these things, mood, neurons, especially in the cortex, tangles, plaques with amyloid. Amyloid is interesting. We know it's autoimmune in nature. The question is what triggers it. If you go down to City Hall in Pittsburgh, you see a statue of late Mayor Caligiuri, who was a 3-time mayor, sort of looking down from the steps there. He succumbed. It was very common in folks of Italian descent. And so he succumbed to it, and the mayor think it was Lou Tooley up in Erie, succumbed shortly thereafter. They both had amyloidosis. So, I mean, he was much younger than the Alzheimer type thing. Interesting. So here you can see the origin. Had a patient, 50s, mental illness, died at 6, autopsy revealed all these things. The cells were twisted strands or tangles, and what we all do is you name it after yourself. That's the way you do it. You gotta do it. It's when we get to Rocky Mountain spotted fever. Did you cover that? Rickettsial diseases and micro. It's named Rickettsia rickettsii because the doctor's name was Ricketts. Okay. The same thing with the thing for Lyme disease. They're named after himself. Chronic, irreversible, bad thing. Impairment, intellectual functioning, reason, remember, imagine, learn. Sounds like me on a bad day. Blah. Here you go. So you're just trying to see some aspects, the notable asymmetry, the shrinkage. This is the hippocampal area, how that's really affected early on. So if schematically, this might give you a little help. 65 to 74, nearly half of those 85 or older may have the disease. So I can blame it on that. I'm 72 and a half. Just saying. So if you see, again, if you get something from Adam M. Stein, Commander, Navy Mill, is my dad exposing himself at workplace, please let me know. I want to put him in a home. He's threatened to do that on numerous occasions. Just wait till you have a 41-year-old son. So as you get 3, I don't know what this number is, 360, or they just misplaced a comma. Good proofreading. Okay, no cause, acetylcholine, somatostatin, which is sort of the thing that stops growth hormone, substance P, which is a pain modulator, norepinephrine, which again we'll deal to. That's one of the substances, also a neurotransmitter in the brain. Cigarette smoking, oh, I'm in trouble. Toxins, you can understand it. Statins, a lot of people are very reluctant. I'm one of them. My former, it's not former because he retired, wanted me to use a statin. I started giving me a headache, so I stopped it. My wife was adamant about stopping it. Avorstatin or Lipitor is my age. Everybody takes it. So my mind, I'm very much of a use it or lose it kind of a guy. Okay, that's my feeling. But the more my mom did crossword puzzles constantly. So this gives you an idea. Certain receptors, this is angiotensin 1, we're going to get into that a little bit. When we start, are tied to the way brain cells bind this particular lipoprotein, and that's where the plaque. So this is where the current treatment is in here. The current treatment is interfering with certain enzymatic activity. There's a new drug I don't know if their name will be in there, but you can look up new Alzheimer's meds. All the ones seem to be interfering with these pathways, by the way.
Isn't there one with like that affects microtubules? It's called like we learned about it. Yeah.
And where?
In Samoa.
Okay. Well, if you guys look it up while I'm talking, that's great. Okay, risk factors, as you can see, family history, blood pressure, head injuries, gender. I didn't know about gender. Okay. Clumps or plaques or bundles. Not a lot to say there. What's unstoppable? I can't read that. Oh, here. Proteins of the nerve cells. Sir.
So with this is like a really bad eventual coma that could like set it in.
Yeah, I think it would. My guess is most times they're repetitive. I do not know enough about it. I mean, the short answer is I don't know. Okay. I would think you would be dealing with somebody with chronic. It's like the CT we see in football players. I think that that's probably an offshoot of something like chronic traumatic encephalopathy. Be there. I mean, it's I'm always curious because I'm the biggest soccer fan I am. All that heading of the ball they do. I mean, it's crazy. So you can see what that is. Neurofibrillary tangle confirmed by whatever protein they're using. So, I mean, here they're looking at the irregularities there, where they're seeing them within those, close, as you can see, fairly close to the cell's nucleus, which is called a cell body. Plaques of amyloid are part of it. And cut into fragments, beta fragments, a crucial form of cell. And this is another protein that undergoes. And again, these misfolding or changing of proteins is where we begin to see that potential association with the protein-induced disease, if that's such a thing. So, all of these types of things. So imagine that. Okay, it could be me on a bad day. No, I mean it's just crazy. Look, I had to run back to Sam's Club because my wife left her phone there in the shopping cart. So, and I'm no better than that. I go ballistic when I misplace something. Okay, understand that my life is about my memory, in a sense, my ability to do what I do here, without having to constantly look it up or refer to notes. It's all here. And the minute I don't forget something, I don't remember a name, even a name of somebody in sports from the 50s. It's like, oh my God, something's bad's happening. So these are the short-term memory, particularly personality changes. When we see somebody doing things differently than they did before, repeating things like they did before constantly, then you see that. We see it in my mother-in-law. Of course, she's 97. God bless. I mean, she can repeat. She would for the last 10 years. She's been telling the same stories. I mean, if you didn't know it, the former hockey voice Mike Lang, his office was at the Denny's on McKnight Road. He was there every morning. And she'd go there, and he'd go and hug her, and she'd tell all about that. That's where he did all his game prep. So, I mean, I can't even tell you how many times I heard the story that are there. So, psychiatric assessments, imaging is now much more, I think, probably more because you don't want to do invasive stuff if you don't have to, like cerebrospinal fluid. But that might be to rule out, some type of infectious component that's there. So, loss of function in the temporal lobe. So, you're looking at a PET scan, and we're not seeing you're seeing not a whole lot going on where it's supposed to be going on down there. These are the ones. This was the Aricept was one of the early ones, prolonging acetylcholine, which plays a role in all of these things. I'm sure they're all almost identical. With physicians, we always choose something. Your choice of a medicine is based on how it has worked for your patients, because a lot of times it's things like side effect package that's involved. Okay. And so you can see an antagonist here. NMDNA receptor inhibitor overstimulation by glutamate. Glutamate irregularities occur in damaged nerves. All of these, and there's so many of these other things. And a lot of times treating patients with brain problems and neurological problems is like a cocktail. Would be a way to describe it. It's like a recipe. I remember that when we treated rheumatoid arthritis, maybe I told you about it. I worked with a legend for a summer. And it's like, we use a little bit of this and a little bit of that. And he's, maybe I'll add a little more painkiller here, or a little more muscle relaxer here, or a little more of this, or and I hope I get something that can alleviate symptoms. That time they were using gold injections, which was a treatment at that point. Psychosocial intervention, I think, and again, I think that when the more you stimulate people, I'm a big use it or lose it thing. Gradually renders them incapable, and then management. And it's so difficult. If you end up working, my wife and I both done a lot of geriatric work. You have to be so careful. I mean, you can't. Liquids and solids don't work after a while. You have to use purees because they're easier to swallow. I mean, it's a whole gerontology is a whole very, very interesting field. I spent 25 years basically taking care of old people. Make me feel younger. Nobody thinks you're funny.
I think you're really funny.
Like funny haha or funny peculiar.
Like, a little both.
Thank God for honesty.
Yeah, you're welcome.
Okay. It's very difficult to diagnose. Is life expectancy is reduced. Okay. Following a diagnosis, approximately 7 years. My mom was about 7 years. Of course, she died when she was 93 years old. It's a good run. Not a big deal. Okay. It never happened when somebody goes, but my sister and I were very happy, that if she was suffering, that would happen. But fewer live more than 14 years with that. And that's interesting numbers. Other things, heart problems, diabetes, alcohol, and, these are anything is impactful. Comorbidities, as we learned during COVID, are much impactful. The underlying cause of death, typically pneumonia, sometimes dehydration. Okay. It's just the immobility and lack of doing things. Your breathing and the very fact that we move around really assists us, our lung function to a great extent. All right, that's everything. So I need 2 topics for Wednesday. Give me 2 topics at least for Wednesday, and maybe we won't have to be here on Friday. Would we
We're not
go?
gonna be here on Friday anyway.
What?
We're not gonna be here on Friday.
That's true. I don't know what to do. I may have to actually be sitting here when we take the final. I don't know if you guys have to or not. It's Dr. Badger. Blame him.
Oh my God, I'm gonna have a, wait, why would you have to sit here? Weird.
We're supposed to do on-site class, supposed to have on-site finals. Now, I may be,
That's not really gonna work for me.
we'll figure this out. I'm going to try to come up with a plan. I've got a week plus 2 days to decide what to do. Oh, no, we'll do it on Blackboard. But maybe having you bring your computers in might be a way to do this. I might even be willing to give you more time and be able to use your computers to their fullest capability.
Yeah, I was gonna ask
What
you
about,
that.
Stein, what about other resources?
I could probably deal with that.
This will be the best.
Wait, other
resources.
Get over this now, because when we come to physiology, the world's going bananas.
I don't like,
No matter how pleasant you are.
alright. Do we laugh yet?
No, you have lab. No, she has lab.
So, I mean,